Hi everyone. So today again I'm here with yet another interesting topic again, which is called halitosis. What is halitosis? Halitosis, simply put, is bad breath or bad mouth odor. Everyone must have experienced this at one phase of life or the other. It can be temporary when you don't brush in the morning, it's there, okay? But sometimes most people they have it often, okay? They have it there, it's there over time. So it is what does it do? It tends to reduce your self-esteem to the lowest limit because this mouth odor, some people is a turn off for them totally. They don't want to come close to you. They will be very blunt with you. They'll tell you that you're having mouth odor. They'll even tend to do some kind of facial expressions that you will not like. Okay, then other people they will not even tell you, okay, because maybe you are a relative to them, you are a friend to them, so they will fear your reaction, they will fear that they will scatter the relationship when they tell you, so they tend to stay away from you. So it's an embarrassment, it embarrasses you. Okay, most people are aware, most people are not aware. So this bad mouth, bad breath is very important to raise your self-esteem. It's very important to take care of your oral health. Okay, oral health is very important. So what are the causes of this oral health? Halitosis doesn't just come on its own. It is caused by certain things. First of all, poor oral hygiene. That is the first cause. Majority of it is caused by poor oral hygiene. 90% of it is caused by poor oral hygiene. What's poor oral hygiene? Not brushing properly or not brushing at all, or when you eat some kind of food, you leave it to hang around the mouth, okay? You do not take it out. Microorganisms tend to feed on it and they tend to cause decay. They tend to bring that odor from the mouth. So halitosis is caused by poor oral hygiene, 90%. Then the other 10% can be attributed to disease conditions. Disease conditions like DKA, okay, that's diabetic ketoacidosis, right? Then also gingivitis, which is inflammation of the gum, tooth decay, there's periodontitis, there's also, you can also have things like liver failure, okay, there's things like kidney failure, okay, there are things like cancer. There are things like there is stomatitis, which is called poor production of saliva. There is hyposalivation, hypoproduction. Okay, due to some disease condition. Okay, there's oral cancer. Also, tobacco and alcohol consumption, tobacco smoking and alcohol consumption can also lead to halitosis. Also, eating things that have food that have smell like garlic and onion has a lot of smell. The smell is very strong. So if you eat such things, they can lead you to this halitosis. All right. So those are the causes, major causes of halitosis. So what are the types? There are types of this halitosis. Types of this is classified into three types. What are the types? The first one and the major one is genuine halitosis, which is you are sure it is on record that you have this halitosis, on record that you have this mouth odor. Okay, there's no one that can challenge it. If you want to test whether you have mouth odor, you don't to see whether you have mouth odor. Okay, the mouth odor is there. When you breathe out the breathing, you know that you have mouth odor. Nobody needs to tell you that. Okay, and the second one is pseudo. Pseudo, which means false. There is true one and there is false one. You believe that you have it, but you don't have it. You can ask somebody to check your breath, but you don't have it at all. But it's just a belief, just in your mind that you have it. So they tend to like shy away from people. They tend to, but they don't have it at all. They can do anything just to prevent this, but they don't have it. Then the third one is halitophobia, which means there's fear. That is like a mental condition where you have fear of bad breath. Yeah, smell bad breath or mouth odor. There's just that fear there. It's kind of psychological condition. Okay, so it's three: the genuine one, the fake one, then the halitophobia. Okay, so how did you challenge this? Before you treat this, before you have to know the cause of it. You don't just treat it. Okay, you have to know the underlying cause. What is causing this? I feel like there are different causes of it. Okay, so you have to know the cause of it. First of all, brushing twice a day is very important. That is the simplest method. You use water, toothpaste to brush. So it's very simple. It's something that you don't need to be taught except you're a child. Even a child, you need to teach the child how to brush. So you brush twice a day. Okay. Also, you floss. This is a floss. Okay, you use this floss to floss your teeth, okay, to remove anything that will be hanging there, anything that will be hanging that will invite microorganisms to your mouth. Floss it very well. Then you can use this one to also remove it. Anything. This is a floss, okay, just like a toothpick, but not the wooden one. It's different from the toothpick. It has a rope that so that you avoid those holes in your mouth. Okay, you use it to floss it very well. Okay, then the third point is that you use a toothpaste that has zinc. Zinc help in eliminating all these microorganisms. Right, so you use a toothpaste that has zinc in it. You also use a mouthwash that has chlorhexidine. I spoke about chlorhexidine in my last video I made on the umbilical cord care. Chlorhexidine has antimicrobial activities like an antibiotic. It helps in eliminating germs. All right, so it's used in also disinfecting wounds. It acts like iodine. It helps in disinfecting wounds. So it comes in gel. It comes in solution. Okay, so the chlorhexidine now we're talking about, it's a mouthwash. So you use it to wash the mouth out. All right, to eliminate any microorganisms that might be there. Okay, and also to reduce swelling, that is gingivitis, to treat gingivitis. You use it to. So also, now, if it is DKA that is the problem, you go to the hospital, you treat DKA. I told you it's a medical emergency, okay, or if it's a cancer or any other condition, you go to the hospital to get treated. Okay, also go for dental checkup. Let me ask you, let me pause and ask, how many times do you go for dental check? People do not go to the dentist except they have tooth problem. It is important you check up with the dentist twice in a year, or if you have a teeth condition, you can go 4 times in a year to check a dentist. All right, it is allowed. Okay, so also avoid things that have smell like garlic. If you want to eat garlic, you can swallow it, or even if you chew it, you can rinse off your mouth properly. Okay, rinse off your mouth properly, or brush your teeth very well to avoid the smell, because anybody that comes close to you gets garlic. If there's garlic, if it smells all over your body, so in as much as it's medicinal, it's very important you also brush your teeth properly, or so that you don't make other people to shy away from you. Okay, also the other point is that use a chewing gum that is sugar free, because as I said, poor production of saliva helps in digestion. It helps in cleansing the mouth. So if you use chewing gum, you chew very well, it can help in production of the saliva, so it helps in making the mouth also rehydrating the mouth. Okay, so also you can drink a lot of water. Okay, because if in case of dehydration, you need to drink water to help in saliva production, to help in keeping you hydrated. Okay, finally, avoid tobacco smoking. Okay, tobacco smoking and alcohol. I told you these things that are dangerous to health. You don't benefit from them. The cost they take from you, they are parasitic. Smoking takes from you. It doesn't give you anything. Smokers are liable to die young. So it's better you avoid it as much as possible. So halitosis is a disease condition. It makes the mouth, it makes you uncomfortable, it makes your relatives uncomfortable. So practice these simple health tips to keep your oral health healthy, to keep your oral health safe, and also to prevent disease. So thank you, and see you in my next video. Bye for now.